The following program is classified G. It's suitable for all ages. We would like to remind our viewers that the views expressed in this program by our participating guests are solely viewpoints of them who take part and does not reflect the views and beliefs of the Derana Media Network.
Welcome to this week's edition of Gen XYZ. Now, since the program has constantly decided to focus on issues that are contemporary to the youth and really identify on a weekly basis what the youth have identified and has issues in the general consensus of the country, we decided to shed some light on a subject that has been plaguing the country for quite some time. Now, September 10th is identified as the World Suicide Prevention Day. Taking context out of this and the problem of suicide existing within the country, we decided to discuss this specific matter within Gen XYZ. Suicide has stemmed from a number of causes, being predominantly social, and there are other factors. We really need to pay some attention as to what these factors are and get a proper understanding from individuals that have experience on the ground dealing with this situation on a daily basis. Understanding the causes and methods of prevention have been pivotal in finding a sustainable solution. A number of organizations within Sri Lanka, both mature and youthful, have decided to fight misconceptions and taboos that have arisen in terms of suicide prevention. A question that we have to ask ourselves is, how can we support individuals having suicidal tendencies and support the reduction of people dying by suicide? To discuss these matters, given that it is sensitive, we decided to bring together two individuals that have this kind of experience on the ground to really relate what the issues are and how we can prevent this from occurring and save the youth, save the people within this country. So to get into a proper discussion, a proper cross-section of this subject, let's go right into the discussion. We are with Gen XYZ. Welcome to the discussion portion of Gen XYZ. We're tackling today a sensitive topic, a topic that is affecting a lot of people within this country and around the world. And we wish to take a proper detailed conversation with regards to this, because even though this discussion does prevail from time to time, we see that there are in certain areas within this topic itself, there are points which are dark. There are points which exist in a vacuum, because this is one of the most personal emotions, one of the most personal problems that people face. So let's get right into that discussion, and we have brought together two individuals that can really give us a proper background into this. We have brought Nivendra Uduman, an individual that has been quite prevalent within this industry. He has been speaking about mental health awareness for quite some time, and Ranil, Thilakaratne, who is the manager of the 1333 line, the CCCline, you counterpart with CCC as an organization, and there's a lot of things that we need to really dwell into this discussion as well. My first question, I'll start with Nivendra. Yeah. You work on mental health, you're a counselor, you have worked on that industry for quite some time. Counselling psychologist, if I'm not mistaken, yes. My first question is, since we are talking about suicide awareness, and this sort of like sensitive topic, what kind of work do you engage with in relation to this as of now? Where do you think we are heading in terms of awareness within the country? Could you give us a basic introduction?
Yeah, sure. So talking about me, I've been in the field for about 6 years now, practicing in Sri Lanka. So I mainly focus on my psychotherapy practice, where I help people with various mental health or psychosocial problems. But apart from that, in the larger community, I've been doing a lot of awareness raising work over the past 6 years that I've been here. After I finished my studies, and most of it has been going around the island, literally going around the island and educating people not just about mental health, but also promoting good mental health, how they can live fulfilling lives, how they can improve their mental health, rather than only talking about mental illness or suicide, for example. So that's mainly been what I've been doing through various platforms. So it's been at community centers, it could be at MOH offices, it could be at schools, but it could also be on the media, where I've been trying to get the message out in whatever way I can. Yeah.
All right. Thank you again once again for joining us today. Okay. I want to go to Mr. Ranil. to get your take on this now. A very unique experience, I would say, you are having pertaining to this specific issue that society is facing, and I believe you've taken this job extremely seriously, and the awareness aspect is happening all throughout the country. There are walks, it has been taken to society so well, I would say, through CCC and through your organization as well. My first question is, give us a brief introduction, because I want to take a more experienced sort of like consequential sort of questions from you about what you face on a daily basis, the kind of situations that you come across. So what kind of work do you engage with through the 1333 line, and something that has gone into society, as I mentioned? What kind of experiences do you work with on a daily basis?
Yeah, so our organization is called CCC Foundation. CCC stands for Courage, Compassion and Commitment, and in CCCline we have two projects. One is with Apeksha Hospital and the other one is CCCline. CCCline is 1333. It's a crisis support service. It's 24 hours, it's a toll-free number and 100% confidential. Anyone in the country can dial that number and talk to a trained crisis supporter. In all 3 languages we are available, and like I said, it's toll-free, so that helps a lot. Some of the things we've done is we've reached out to communities, we've reached out to schools. We have another program called Let's Talk, where we are reaching out to corporates and to schools to help them also build up their communication. And we just ended our annual bikeathon, which is a 13-day bike ride around Sri Lanka, and also we organized a mini walk from Golface to Independence Square, which says let's talk and walk. And of course, Nivendra and I have done a couple of programs together. We also did a walk along the coast of Sri Lanka to create awareness. And wherever it's possible, we've tried to create awareness. And of course, your media has been very helpful in creating the awareness, because I believe that the more we talk about it, the more we can come out and share about it as well. So CCCline 1333 is been there for 10 years now, and we are still fighting to shatter the stigma.
All right. I think that's a very, towards the end you brought up some very important idea that we have been talking about this, but the stigma still exists, and it shouldn't, basically, because mental health, the issues that people face when it comes to mental health it's prevalent, it's there, and somehow society has taken a back foot. Maybe sometimes they don't really want to look at that with the same amount of seriousness that they look at other diseases. Nivendra, I take that segue straight away to you. I want to take your take on, like, if we directly go into the subject of suicide. Now, since we are on Gen XYZ, we try to focus on youth issues mostly, and I want to take your understanding of what is it like, the picture right now for suicide within the country. We'll towards the latter parts of our program, let's talk about how it occurs, or the kind of things that people can do, the ones that are associated. When it comes to the youth, because I believe I met you at an event once, and there was this idea that Sri Lanka was the 6th highest when it came to suicide rates, and then you had corrected it and mentioned that it was way low. Even if it's lower, it's still an issue within the country. How has and that also is sort of like a perception issue, one would say. What is the situation like right now?
Okay. So, I mean, looking at Sri Lanka historically, we know that suicide has been always quite a major public health concern. So I won't say mental health concern, I say public health concern, because it affects all of us. It doesn't discriminate. And I think each sector in the health sector can play a part in preventing suicide. So that's why I call it a public health problem. So if you look at history, in the years 95, 96, Sri Lanka was the first or the most highest in the world when it came to suicide rates. And at that time, the main kind of reason for that was the easy access to pesticides that was causing a lot of farmer suicides and other people also taking their lives. So there were several interventions made by the Presidential Task Force at that time, and plus other organizations, both non-governmental and governmental, to reduce access to these lethal pesticides, and also to create various pathways for people to seek help. and there were certain organizations that did projects like, for example, installing lockable cabinets in the farmers' homes where it had 2 keys. So the farmer couldn't open it by himself, he had to ask for the other key. So that was one of those creative methods used to try to prevent suicide. So over the years, the deaths by suicide have reduced because of infrastructure developing. So we have good healthcare and good pre-hospital care, right? And transportation has improved, so people get to hospital faster and their lives are saved. But that doesn't mean that the suicide attempt rates have always been at a low. So we find that even today, attempt rates are quite at a high number, even though we don't really know exactly what the real numbers are, because some of it goes unrecorded and some of it goes recorded as other types of things like accidents, or so not always a suicide attempt because of the stigma attached to it. So if we talk about the deaths by suicide, like I said, it has reduced over time. And I think Sri Lanka has done quite a bit of work in order to address this issue. So, for example, the mental health unit of the Ministry of Health, they've had various projects that they've done and various initiatives. Then you have the National Institute of Mental Health and other government bodies that have also been quite pivotal in trying to see how we can prevent suicide. And then there are non-governmental, like the 1333, there's Sumitreo and a couple of other organizations that have been quite active in the field of suicide prevention. However, having said all of that, it still is quite a serious problem in this country, especially amongst young people, but we can't also then neglect people who are middle-aged or elderly, because the numbers show us from especially last year that middle-aged and more towards the elderly, that population also had quite a high number of deaths by suicide. But if you look at a global picture, we say that people between the ages of 15 and 29, suicide is the second or the third leading cause of death. And in some countries, it's now between 10 and 29. So the age has come down, right? So in Sri Lanka also, historically, we've seen that a lot of young people are at risk of attempting because of various factors. But having said that, we can't ignore the other age ranges, because a lot of the time when we talk about mental health awareness in this country, we tend to focus a lot of our efforts into the school-going population, into the university population, adolescents and young adults, but we hardly focus on the other age ranges. So, and another important issue is, Ranil, that a lot of the awareness that we create still hasn't penetrated the more deeply rural areas in this country, because they don't have access to social media. They might not even have access to mainstream media like newspapers or the radio, right? So getting this information out has been a challenge for both the government and non-governmental sectors. So we are also kind of leaving behind a portion of our population,
large portion,
when we talk about awareness, because in Colombo there's easy access to help, and therapy is something that we are now talking about. Psychiatry is something we are talking about. People are more open to go and seek help, and that's a really good thing to see. But if you go out of Colombo, I think Ranil and I can share a lot of stories. If we go outside of Colombo, that is hardly the case, because there is no therapy outside of Colombo, right? And if you go into like places like Anuradhapura, Polonnaruwa, even down south to places like let's say Bentota, Panadura, you won't find easy access to care, and also you won't have this same kind of conversation you and I are having.
All right. Okay. There's a lot of important things that you have really, we can stem out from what you just mentioned. We really need to take a short commercial break. We'll be back with more on this subject. We'll go deeper into how we can really build awareness amongst this issue that society is facing as of now. This is Gen XYZ. Stay with us. Welcome back to Gen XYZ. I want to directly go into Ranil and really talk about your campaign, this entire movement that we have built around really focusing on this issue of suicide. Now, a good context that Nivendra has given us to really build our case on. I want to take your, in terms of experience, in terms of you taking a step back and looking at the situation right now, because awareness has been key and that is what can really contest this taboo that exists within society as well, because unless that barrier is broken, it is quite obvious that we can't proceed forward. What is your experience in these lines? How has the youth awareness on this increased, decreased? How can we take the next step? Because my next question is going to be on social factors that are that are influencing this. So yes, how do you read this entire thing?
Well, I believe that education and awareness about suicide prevention and mental illness is very important. A classic example is I remember about 10 years ago when we never spoke about TB, right? It was taboo. We were scared of the disease. We didn't want to associate anyone with the disease. But then the government ran a campaign, and there was awareness created. And now it's no more issue. There is medication. The people are accepted in the society. All that, and even COVID. Right? People got very scared, but again, government acted on it, said, oh, these are the things you need to do: wear a mask, wash your hands, have social distancing. People acted on it, and now we are all okay. We are just going around. We are back to normal life, right? Because the government took the proper actions. Same way about suicide also, and mental illness, we need to talk about it. We need to make it okay not to be okay. Right? We need to tell people it's okay, talk about it, it's okay, go and meet a doctor. If we have some kind of disease physically, we will go and see a doctor. But mentally, we don't want to go and see a doctor or a psychologist or a counselor. So we need to put it out there, right? And talk about it. I'm very happy to say that there are a lot of young organizations taking that mantle on. Right, Light, then Suicide Defined. They're super organized, very, very young people who, still school going, right? And even clubs like the Interact Club in many schools have invited us and asked us to speak about mental illness, resilience, about suicide prevention, and it's surprising, right, to see young people. And it's also good because we need to talk about it. We need to create awareness about mental well-being from a young age, and so that they'll go and talk about it, right? So I think awareness needs to be a little more, actually much more, through all lines of media. And but now amongst young people, the moment we ask them to promote mental well-being, they'll go to Facebook or Twitter or something like that, because that's easy access. That's where they have access to you. But the general media, right, needs to take a little more, responsibility and a little more to create more awareness about the services that we have, right, and to create to talk about the subject. Yeah.
All right. I think before we go into the social factors, and something I really picked up from what Ranil mentioned is the issues that you face as we take awareness forward. Now, taboo is definitely one, the kind of taboo that exists within society. If I come back to Nivendra, and my question, the crux of the question is going to be, what is affecting the youth, and let's make that a segue to go into social media as well. But something I want to understand is, okay, what are the issues that you face when you take this message forward? Maybe the issues might be different in Colombo, and it may be different when it comes to rural areas. And like we had really, the youth that exists, the people that exist in all those areas should be, given that kind of priority. Yeah. My question then is going to be, okay, what are these barriers that we are facing? If you can really focus on what the barriers are in moving forward, so that then we can understand why the youth are being pushed towards suicidal issues. Now, again, the economic situations, I believe, are certain things that have been affecting people over time. But if you could give us this is the general understanding I have. If you could give us a broader view of what are these factors, and what are the factors that push people towards this risky situation, and B, what are the issues that you face when taking this message forward?
So I think these are two questions that you can look at very broadly, right? So if you look at the first one as to what are some of the social influences, I think most of it starts at home, right? Especially as a young child. It would start with parenting, it would start with the information a child is given at a certain age about emotional well-being. It's about whether our schools are teaching self-esteem, whether our schools are teaching resilience, emotional intelligence to our children. And I think also, like I said, there is no guidebook or manual on how to parent, right? And a lot of parents do how they were parented when they have to parent their own children, or some parents experiment, they try different strategies of parenting. But sometimes children tend to go through a lot of trauma in childhood. Not just, when we say trauma, we don't only have to talk about sexual abuse or corporal punishment, but we also have to talk about how their emotions are validated as a child. Right, so simple thing, in our country we see this a lot, where let's say a boy, for example, is playing at home and he falls and injures himself. A lot of the time, from the stories I've heard from people who come to see me, and I'm sure Ranil has his own experiences as well, a lot of the time they wouldn't be soothed. They wouldn't be told, okay, you fell, you hurt yourself, it's okay, let's deal with it, right? It's okay to feel upset when you're injured. But a lot of the time the response a child would get is, don't cry like a sissy, or don't cry like a girl. If it's a boy, stand up and just, sort yourself out. So a child learns very early on that certain emotions are not meant to be felt, that they are meant to be suppressed, right? Child learns early on that they are only allowed to express certain emotions because other things are unwelcome by the adults in their life. And that tends to carry on into middle childhood, into adolescence, and then even into adulthood, right? Where they learn, especially men, but also we have to acknowledge girls as well, you learn that certain things are not permissible. So because children are not soothed and they are not given the skills they need to regulate themselves as children, as adults or as young people, they find it very difficult to regulate themselves because they haven't learned the skills. We can't blame them, right? Because it comes down from the time the child is in the womb. Mm-hmm. And another aspect, when you talk about social influences, which is very interesting, is we have to acknowledge the prevalence of intergenerational trauma. Right? So we as a country, we have faced numerous years of trauma, right? There's been the civil war, there's been natural disasters, there's been insurgency, and also general inequality, poverty in our society. So let's say when one generation experiences this and they experience the effects of trauma, it could be alcoholism, it could be domestic violence, it could be rape, it could be sexual abuse, it could be a range of things that are the consequences of going through trauma. And when that is not dealt with, when people don't do the work to heal because sometimes they don't have ways to heal, because of the inequality in accessing support, right? We know now that through our genes and the certain changes in genes, we call this epigenetics, right? Changes in genes, it gets transferred into the next generation. It goes through the sperm, it goes through the ovaries. And it's basically in our blood, right? So the child would have that genetic vulnerability as well. But just because you're genetically vulnerable doesn't mean it just pops up like that. Mm-hmm. But the child has to have the environment that also supports that genetic vulnerability. But if the environment is different, where it's supportive, where it's more nourishing, nurturing, then the genetic vulnerability doesn't necessarily have to pop up. So that's one thing I think it's very important that we talk about, right? Because there is that prevalence of trauma transferring from generation to generation. Besides that, if you look at school, right? So there is very commonly people experience bullying, children experience harassment, sometimes from teachers. And again, emotionally, the emotional education is very lacking, right? We are having this big debate about comprehensive relationship and sexual education, which I think is fabulous. But we are not talking a lot about emotional education, right? So moving along the kind of developmental trajectory, then comes issues like, again, relationships, not knowing how to navigate those things because no one's taught us. Mm-hmm. In our life skills classes in school, at least when I was schooling, I don't know about Ranil, we learned how to make salads, and fruit salad and stuff for our life skills class, but we didn't learn about resilience, we didn't learn about self-esteem, we didn't learn about how to cope, we don't learn coping skills. So a lot of the time, adolescents, young people, they tend to learn their own ways of coping with stuff which might not always be healthy, right? So that's one thing, and I think now the social pressures are so much when it comes to the internet, when it comes to social media, when it comes to pornography, when it comes to also sexual abuse, harassment that young people, both boys and girls, would go through. And also the gender stereotypes around being a boy and being a girl, right? Now, if you take suicide, because that's what we're talking about, globally we know that men tend to take their lives more than women, right? But that doesn't mean we have to leave girls and women out of the picture, because they are also vulnerable in different ways. For example, if you talk about maternal care, right, mothers, we know that in Sri Lanka there's quite a high prevalence of postnatal depression, postnatal anxiety, and that is a huge risk factor for women and young women to consider suicide, right? And also there are issues like teenage pregnancies, marriage at a very young age, right? Especially in rural areas in Sri Lanka, we find this, and in certain communities we find this. And that also can be an indicator, because I think especially when both of us were walking around the country in 2018, we came across a lot of villages that had girls as young as 13 and 12 carrying infants, right? So all of these social factors we have to take into account. So we have to move out of this argument that it's all about biology and genetics. We have to move beyond that and look at our society, look at inequality and poverty and the lack of access to care as well when we talk about young people.
I think that's again a lot of things to think about in terms of context and really understanding this. I really want to take a short break, and we'll get Mr. Ranil's take on this as well, about how we can proceed forward from this point on. You're with Gen XYZ. Stay with us as we go into our final two segments of really understanding what this condition is and how it's affecting Sri Lanka. Stay with us. Welcome back to Gen XYZ. I want to go to Ranil about the context that has been established right now within our discussion, and to give us a take on, because when people do see awareness campaigns going around the country, but when it comes to suicide, most people don't know what sort of like the information that has been gathered through this this community service that has been done. Ranil, if you could give us your take on that specific aspect, what are the stories that you hear? What really is present on the ground? And how has the walk and the bikeathon that you all do annually, if you could give us some details on that, I'm pretty sure there'll be a lot of people, like a lot of our viewers, would like to join in as well. Give us a bit of context on that, really, about how, because I think something that you acknowledge and was very important, and even those organizations who did not appreciate it, is the fact that there are other youthful organizations that are also coming up in all of this. So what have you seen as certain experiences that you have had when speaking to people, these cross-cutting issues that you believe that should really be dealt with, and then talk a bit about your organization and what you do with these awareness campaigns.
So every year the bikeathon happens. This was our 7th year. So we start on the 29th of August and we go on till the 10th of September, which is World Suicide Prevention Day. And every year it's a different route. But we ride 1,333 kilometers together in 13 days, covering 13 cities. That is to keep with the number, 1333. And the experiences are amazing. From city to city, from area to area, it's always different how people react and how people welcome us. And we've always been welcomed. Always people have been very receptive to the topic. But one thing we experienced this year, and most of our riders, because generally what we do is we ride in the morning and we reach our destination by lunchtime or before, and in the evenings all the riders, even though they are tired, they will go into town and create awareness with the volunteer team. And all the riders, what they feedback they gave us this year, the youth were not very receptive. When we went out, we gave out a small leaflet, pocket-sized leaflet, with all the details on how to contact us and some important numbers on the other side. It wasn't very receptive, but with the adults, they took the card, they started talking to us, they started asking us. So that difference we saw this year. Maybe it's because of COVID, maybe they've been told, not to take anything, but that was a big difference, because the Rotary Club helps us organize these events, and so some of the areas they planned were near classes, so you see a sea of young people coming out, but when we started giving out the leaflets, they were not very receptive. So that we experienced, that was a difference this year, but normally it doesn't happen. During the walk, it was amazing, because we were on foot, right? The three of us, myself, Nivendra and Sarah, we were on foot, and so every shop we went to, banks, right? Big, banks in Sri Lanka, commercial banks in Sri Lanka, they put aside a few, they had the cashiers to work, but they put aside, about half an hour and told us, come, share the message, because we don't know about this. A lot of areas we went to didn't know about the services, and some of the services are available in their cities, right? Most of the cities don't, but some of the cities do have, facilities. They have counseling centers in the hospital or in the, in the GS office. There are places where they can get help, but so we went to this Samudriya, where people were gathered, then in shops, in post offices, in schools. In schools, of course, we did carry letters from health ministry and all that, so they first checked us before they took us in. And some of the experience, some of the stories they shared with us. Like one lady, we stopped to have some tea. People, small shops even didn't take money from us when they heard why we were doing this, right? But one lady I remember very well. There are two stories that stuck with me throughout the whole walk. One was this lady, Nivendra and Sarah, myself, we stopped to have some tea, and we had the tea, and these two continued walking, and I paid, and I asked her, can I paste some stickers on your shop? She said yes, and while I was pasting, she said, Ane sir, of course in Sinhala, she said, Ane sir, if I had known about this a week ago, I could have saved my niece. Right? And I couldn't even talk to her after that. Right? So just the awareness, right? Talking to people that there are services like that. It's okay to go and talk to a doctor. If she had known about it, she could have helped. So there are different experiences. And one thing I would like to add is there are like Nivendra said, the male suicides in Sri Lanka and around the world are high. But in our center, in 1333, most of the calls we get are from female. Right? And you'll be surprised, most of the calls we get are not financially. About 40% of our calls are for loneliness and relationship issues. Right? If you talk to a person, generally, when we're on the road, they'll ask whether you'll pay my bills or you'll do something, but mainly it's for loneliness who call us and for relationship issues. So I think as a society, then we need to turn around and look at ourselves. If we have we failed? Because if people are calling a stranger whom they don't know, they don't know where this person is, what culture, what religion, what background, but they'll call and tell them their innermost secrets and desires to a total stranger, right? So some places where we went, of course, they said, if they are going to die, let them die, right? But that's because people don't know. People are not educated in this area. So I think again we need to educate people. There are places that are doing great work, and this is reality.
I think something I want to take out of Ranil is this this picture that you have just really given us. I think a lot of things to think about, be introspective of us as well. That I want to take to you is this issue of connectivity, this issue of loneliness that you speak of. Now, social media was supposed to make the world more connected, and that was the kind of the ideal, but then I think, as we have discussed with a lot of psychologists on this program as well, social media has this tendency to isolate more people than to really connect them. I want to get both of your take on, since you all also work on social media and we really use social media support in taking this message forward also. Nivendra, how have, I'm pretty sure this question has been thrown at you quite a few times, but let's really connect it to suicide a bit and really take, there is cyberbullying and things like that that is happening as well. But how can social media and these unique tools be used to support this cause more than have that as a weapon against this? How has that played around with the youth? Because we constantly say, and there's a perception amongst adults also, social media should be controlled when the youth use it. There should be counseling, there should be people overlooking how it's been used. What is your take on it? I want to get Ranil take on this as well. How have you really understood it?
So one thing I really want to say is that a lot of the narrative these days is that social media should be avoided by young people, shouldn't be used, it's bad, they're addicted and extra. Yes, it can be addictive. It is actually an addiction that we find these days. But at the same time, I want to say social media in itself is not a bad thing, but it's about how we look at it, right? So one thing is that it can have an adverse effect on someone's self-esteem if their self-esteem is already low. Now, we see these days, especially around likes and comments on social media, that contributes to a lot of people's self-esteem suffering because of that, right? And that can also cause issues, long-term issues like depression and anxiety and other mental health problems. So besides self-esteem being affected, I think the other thing is people are beginning to be more comfortable talking in a virtual sense or communicating in a virtual sense rather than having face-to-face interactions with people. And I think you see that within families as well. Some families text each other when it's dinner time rather than really calling their children to come. It happens, it's real, right? It's not just a made-up story. So it is, I think it is causing a sense of disconnect because we like to call ourselves a collectivist culture, Sri Lanka. But having said that, we also have to look now that we are also turning into a more individualized, especially in urban settings where people are disconnected, right? I mean, getting out of the house to go and meet someone now is more chore rather than something enjoyable to do for some people, especially amongst young people these days. Whereas sending a text is much more convenient and easy and less effort, right? Now, because everything is now related to effort rather than actually being a pleasurable experience to meet a friend or a family member or something, right? The other thing is, of course, there's risk of people being bullied, trolled, harassed, mobbed on social media, which has happened quite a lot. And I think especially during the curfew with COVID-19, we saw a lot of young people struggling with being bullied, with being with their nudes being shared by their partners, and that and a lot of I myself dealt with several young people who were at risk of suicide because of the nudes being shared, which we had to intervene during the lockdown or curfew, right? So again, so if you go back to basics, it's not social media that is causing our problems, but it's how we live our lives, right? We don't get enough sunlight anymore. No, it's a fact, right? We don't get enough sunlight in the mornings, which is extremely good for us. We don't eat always healthy food, right? We don't get enough movement because we are meant to move. Human beings are meant to move, not just to sit like couch potatoes. But these days it's happening more that we are more seated than we are doing anything else. So those little basics also tend to impact our mental health or the lack of it, right? And coming to social media again, so to go into the next part of your question, I think it already does play a magnificent role in getting messages out around suicide prevention, mental health, emotional well-being, right? And because of that, a lot of young people, especially young people, have very easy access to support, both on virtual spaces and face-to-face spaces. Because now, for example, counseling is being taken into the online sphere a lot more as a result of COVID-19 and the ensuing curfew. And so things are shifting where people are able to access. But again, like I said at the start, we are not penetrating into those communities that need this the most.
Yeah, I have to stop you there. We'll go for a short break and we'll come to our last segment. You're with Gen XYZ. We'll quickly go in to our last segment and get a sort of conclusive message to the other people that are involved. When you have some individual that is at risk, how can someone behave in that capacity? So you're with Gen XYZ. Stay with us. back to Gen XYZ, and this is our last segment. I want to go to Ranil. I don't want to take much of your time. My question is basically, now we gave, I think, some excellent context to the situation that we're facing right now. We have to really take this message forward. We're protecting lives through this. I want to get your take on, both of your take on basically, other people that are involved. If I know someone who is at risk, what those individuals should be doing, what your advice has been, what your experiences have been with this, if you could give us something.
So we spoke about anybody who's going through a problem, right? If you're feeling lonely, if you're feeling sad, if you're being bullied, talk about it, right? Talk to a friend, a teacher, someone you trust, your parents, religious leaders, someone you trust, whom you can share. Same way, I would encourage people to listen, because people who want to talk don't have a place to talk, right? So listen respectively, right? You don't have to be a counselor. There are people who can help you, right? So listen, and if they need more help, then you can contact a counselor. You can call 1333. The advantage, one of the advantages in calling 1333 is, though it's only crisis support on phone, if you need further help, we will refer you to someone who can help you, even a counselor like Nivendra, or any other help you need. So talk about your problem. Go out there, seek help. It's okay to talk about it, and also listen. So once again, thank you for this time.
No issue. Thank you so much for coming. I want to go to Nivendra as well. Your take on all of this, because I think the stakeholders Ranil just mentioned, there might be, we might trust a religious leader, even a parent, a teacher. What should their ideology, what should their primary focus be according to you?
Okay. So first of all, I would like to talk about one of the most damaging misconceptions and myths that exist around suicide, which is talking about is a bad idea, or asking someone about suicide is a bad idea, because that will plant the idea on their head, or they might go attempt suicide. I want to tell everyone who's viewing this program that that's completely false. There is no harm in asking a loved one about whether they're having suicidal thoughts, right? So how you do that is, don't be afraid to use the word suicide. Be direct, don't beat around the bush. For example, I can simply ask, I noticed that you've been feeling or looking really down these days. Have you been having any thoughts about suicide or about ending your life? You can ask very directly, and you get a direct answer most of the time when you ask, right? And to have a very personal and private conversation with that person, and mainly to be conscious of the language we use. So things like, you're not thinking of doing something stupid, are you? Those things we need to avoid. And also using the word committed when we're talking about suicide, because that word carries a lot of stigma with it. So you can use phrases like died by suicide, or taken his or her life, or ended his or her life, or just attempted suicide, rather than saying successful or unsuccessful or failed. So, because that is not productive for us, right? So it's really important that caregivers, parents, teachers, anyone in our community is willing to non-judgmentally listen, and not say things like, oh, I'll help you, come, let's find a way to attempt suicide, because there are people who do that. Or they challenge them in Sinhala, right? Which can really push someone towards feeling so unheard and lonely and isolated, right? So the message I want to really give out is, it's not rocket science. It calls for simple things of us showing compassion to each other, being kind to each other, and to be able to recognize when our loved ones or friends and other people may be going through something. It doesn't necessarily have to be about suicide, but just anything that might be difficult for them, for us to be able to approach them and start a conversation. And then also for us to know when our service or when our assistance ends and when professional help starts. Because that's important that we know that boundary, because we are not their therapist, we are their friend or family member. So that's a message I want to give out, because I think it's a community's responsibility to prevent suicide. It's not just the health professionals' responsibility. So we all are responsible to be able to help save lives in our country.
All right. I think that both as a program and towards the end as a final conclusive message, that was pretty important, and a lot of things for viewers to think about in terms of proceeding forward from this point on within our society. Things that we should bear in mind, the kind of message that needs to trickle down to those areas that is really suffering under this. So I want to thank Nivendra Uduman, Counselling, the psychologist, for joining us, and Ranil Thilakaratne, who is the manager of the CCCline 1333. both of you are doing a huge service and really bringing out something that even on this program we have really highlighted on in terms of mental health and the kind of issues that sprout out from this. So once again I thank both of you. I thank our viewers for staying with us. We will once again join on Gen XYZ next week with another issue or another problem that is contemporary to the youth and really discuss matters further. Thank you for staying with us today. Please join us again next week with Gen XYZ. I'm Ranil. Have a great day.